This is Dr. Famuyiwa, your host of Fertile Talks, and I am happy to invite everyone to Fertile Walk 2025. This is going to take place Saturday, October 18th at 9 a.m. in Rockville, starting from 3202 Tower Oaks Boulevard. So this is more than just a walk. It's a fun, family-friendly day packed with health and fitness coaches, a live fertility and wellness talk, local businesses with interactive booths, and plenty of giveaways and surprises. And as an added bonus, the first 10 people to RSVP will be getting a signed copy of my new book that's coming out in March 2026. It's called The Quest for Fertility. Everyone who registers by March 2026 will also be invited to join our exclusive VIP book club with early book excerpts, bonus fertility tips, and special PDF resources. So, spots are limited. Please RSVP. Go to the link in the show notes and RSVP to save your spot. Can't wait to see you there. This episode of Fertile Talks is sponsored by ILMeds.co, an international mail-order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Hello, ladies and gentlemen. Today we're going to do something different on Fertile Talks. I have a question. What if a childhood illness could silently affect your ability to have children decades later? For many men around the world, Mumps Orchitis is actually that hidden culprit. And today we're going to dive deep into how the mumps virus can damage fertility and what modern medicine can do to help with it. So, welcome back to Fertile Talks, and this is where science meets hope on the journey to parenthood, and I'm your host, Dr. Famuyiwa. So let's unpack Mumps Orchitis, what it is, who's at risk, what actually happens inside the testicle, how it affects the sperm production, and why assisted reproductive technology can still offer hope for men that have this condition. Let's explain it simply. Mumps Orchitis is inflammation of one or both testes that is caused by the mumps virus. This is a single-stranded RNA virus. It's from the same virus family that causes measles or RSV. It's called the Paramyxoviridae family. And it usually happens about 4 to 7 days after an infection of the parotid gland. So it causes what is called a parotitis. You get a swollen, puffy cheeks, kind of like chipmunks. And sometimes it may happen without that visible parotitis. And sometimes the orchitis, which is when it affects the testes, occurs and afflicts in post-pubertal males, men who have completed puberty. So who can get it? Before vaccination, it was probably one of the most common causes of testicular inflammation and infertility. And today, thanks to the MMR vaccine, the cases have dropped dramatically. But they are resurgent in certain populations where immunity has waned over time. I know in my practice, once or twice a year, I see gentlemen from different parts of the world, really, and who've had Mumps Orchitis and now have azoospermia. So the Mumps Orchitis is rare in young boys. It peaks around age 15 to 29, and occurs in 15 to 30% of post-pubertal men who've had mumps as a child. Most of the time, it's limited to just one testicle, 60 to 70% of the times, but in 30 to 40% of the times, it can affect both. So let's see, how does the virus damage the testes? So the virus travels through the bloodstream and it targets the seminiferous tubules. Those are the coiled tubules in the testes where the sperm are made from the baby sperm cells, right? And it triggers swelling and an immune attack. The body's trying to get rid of it. So you trigger an immune cytokine storm. That is when your own body kind of just launches everything trying to fight it off, except in this case, it's going to fight off normal tissue with abnormal viruses as well. And all this inflammation causes swelling, pressure, and it literally just strangles the tiny blood vessels that are feeding the testes because, there's a finite room to grow. So this leads to what we call ischemia or cell death, if you will. And in severe cases, permanent shrinking of the sperm because you've cut off the blood supply feeding it. And in cases where it involves both testes, the immune system can even start to produce antibodies that further add insult to injury and attack sperm. So how does it present? It usually starts with sudden testicular pain and swelling, fever, nausea, usually about a week after mumps symptoms. And the testes may feel enlarged, firm, and extremely tender. It can even make it hard for the patient to walk. So it can mimic testicular torsion, which is a surgical emergency. So that needs to be ruled out first. Testicular atrophy, the shrinkage of the sperm, is one of the long-term side effects from this infection. And that occurs in 30 to 50% of the affected testes. Infertility is usually rare if it only affects one testicle. But if it affects both, then it can occur in 30 to 87% of cases. Now, some of these men may retain normal testosterone levels, so you may not be able to use testosterone to be a judge of that. And the reason is very simple. The virus attacks the cells that produce the sperm, which is coiled in tubules. The interstitial cells, the cells in between those tubules, those are Leydig cells that produce testosterone, and usually those may not be affected. So that's why the testosterone levels may be normal. So diagnosing Mumps Orchitis is usually clinical, usually history of mumps with the classic swelling of the parotid glands. Ultrasound needs to be done to rule out torsion. Make sure you're not dealing with a torched testicle. And then blood work. People with mumps will have the antibodies to mumps. So you have the IgM, recent infection, IgG, old infection. And sometimes you'll have an elevated amylase because of the infection of the parotid glands. Can it be treated? That's the tough truth. There's no antiviral care, right? So treatment is usually supportive. Pain control, ice packs on the testicle, scrotal support, and rest. Antibiotics do not help a mumps orchitis unless there's a secondary infection. So prevention is really everything. Can fertility be saved? Well, if it's one testicle involved, then, most patients will be fine. If it involves both, they may have what we call azoospermia, where you can't find sperm in the ejaculate. However, this man can have microsurgery done on the testicle to extract sperm, and you will find areas, patches of testicular tissues that is not affected. So usually sperm can be retrieved in up to 85% of men with mumps-related azoospermia. And once sperm is retrieved, then it can be followed up with intracytoplasmic sperm insemination, um, called ICSI, and it offers pregnancy rates as high as 85%, with live birth rate around 67%. So outcomes are usually better than other types of non-obstructive azoospermia. Key takeaways: prevention is better than cure. Well, there is no cure, so it's better to prevent it. How does it differ from a bacterial orchitis? Bacterial orchitis can be treated with antibiotics, um, if that is the correct diagnosis. But the key difference with the mumps orchitis is that it cannot be treated with bacteria. So really, again, prevention is the key. So again, this is Dr. Famuyiwa coming to you with another episode of Fertile Talks. If you have any comments, please direct it to us. And please like, share, and subscribe. Thank you for being with us. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.